Welcome to Team 7's Flash Forward Case, the United Kingdom. The UK has a publicly funded healthcare system in which healthcare is provided by a single payer, the British government, and is funded by the taxpayer. This system of healthcare is called the Beveridge model, and under this design there are no medical bills, rather medical treatment is a public service. The health systems of Northern Ireland, Wales, and Scotland are all based on the English national health system with differences in structure and delivery of services. People are not required to buy insurance in the UK, which helps to keep premiums down for those who do choose to buy private insurance. Those who choose to buy private insurance do so to get faster access to treatment, a wider choice of specialists, a more comfortable care environment, and more convenient timing of treatment. The national health system covers those who opt out of buying private medical insurance, or PMI, those who cannot afford health care, and those who private insurers decline to insure. Private insurers in the UK can opt out of covering people and sometimes do not cover pre-existing conditions or conditions resulting from lifestyle choices. General practitioners act as the first point of care and act as gatekeepers for secondary care. All eligible persons are required to have a designated GP who will provide essential medical services. All non-essential services will be provided on a fee-for-service basis. But what challenges does the UK health system face? In short, the UK shows growing strain from the increasing needs of its population and the inability of the system to keep up with that need. The national health system's budget has grown rapidly in the last 20 years, leading to health expenditures taking up an increasing portion of total public expenditure, currently 29.7%. In 2016, UK health expenditures totaled $4,000 per person, accounting for 9.1% of its $2.6 trillion GDP. At the same time, the UK currently has 66 million people, and this is expected to grow to 71.4 million by 2030. While this increases the number of people paying taxes into the system, it is not enough to offset the increased expenditures of a larger population. To a large extent, this is because the growing population will be increasingly older. Technological advances in drugs and devices have made and will continue to make treatment more expensive on average for more people. In fact, 65-year-olds are 2.5 times more expensive to treat than 30-year-olds, and 85-year-olds are 5 times more expensive to treat. Today, 2/5 of the NHS budget is spent on people over the age of 65. This trend could worsen by 2044. Almost 25% of the UK population will then be 65 or older. All this together has created health inflation, or healthcare costs outstripping general costs in the economy. This leads to a shortfall between revenue for healthcare, which is linked closely to the general economy, and health-related expenses, which are less closely linked. Delayed emergency response times, waiting times, fewer beds, and higher patient-to-doctor ratios are the result. The system is under strain. Unfortunately, the government's response thus far has been inadequate. A growing tax base and recent decreases in defense spending have allowed the government to increase spending on health. But the rate of increase is slowing, and this will not change despite the Conservative Party's 5-year commitment to increase spending. Meanwhile, the government's messaging around the need for reorganization of the NHS and increasing local responsibility for health services have done little to advance healthcare in the country or to soften the ground for either future reform or increased taxation. We recommend that the government mount a vigorous, multifaceted response to a challenge that will only grow. Our overarching recommendation is for the UK government to make the growth of its health budget keep up with the growth in health expenses. It should increase revenue by softening the terrain by rolling out public information campaigns on the benefits of a robust healthcare system targeted at taxpayers. It should promote immigration, as immigrants tend to be younger, healthier, and taxpayers. And to be prepared to increase spending in this sector, the government should work with education stakeholders like universities to improve the pipeline that creates GPs, nurses, and specialists to staff a growing system in all locations. The government should lower costs by capping payments for expensive treatments that have only marginal benefits, and change incentives for pharmaceuticals to offer higher priority treatments. It should also get older people cheaper preventative care and keep those not seriously ill out of the ER and hospitals by supporting other, less acute systems of care. The government should also promote community health initiatives in lower income neighborhoods and in neighborhoods with more old people. These neighborhoods tend to have higher incidences of illness and chronic disease. Finally, the government should partner with other governmental, non-governmental, and commercial sector entities to impact lifestyle choices affecting health outcomes. For example, the government can work with National Parks UK and the Ministry of Transport to increase physical activity, with HM Revenue and Customs to offer tax breaks to supermarkets and restaurant chains for offering and successfully selling healthier options, or again, to increase taxes on alcohol and tobacco to fund the budget shortfall. The examples are many, but they all have one thing in common: work across sectors to instill and promote healthy behaviors throughout systems. Above all, the UK government should keep the Beveridge model, an elegant, cost-efficient system of care that has served citizens well for decades. Neither the political climate nor popular appetite suggests any change is feasible or desirable. The system is not broken, but it is rusty. With a good dose of oil and sustained maintenance, all Britons should have a system of care they deserve. In short, keep what works, but don't forget to feed it. Thank you for your time.